say goodbye to monotonous books and say hello to colorful, interconnected mind maps. In this series, we will quickly help you revise important concepts with the help of mind maps, which you can access later using our app. In this video, we will talk about the various features of the deciduous dentition teeth. Starting off with the mandibular arch, let's discuss the mandibular central incisor. The lingual surface of the tooth is usually smooth with a poorly defined fossa and marginal ridges. The root of the mandibular central incisor is long, evenly tapered towards the apex and at times slightly compressed on its mesial and distal surfaces. It's the first tooth to erupt in the oral cavity at 6 months of age. It is the smallest tooth. The next tooth, the deciduous mandibular lateral incisor, is slightly larger incisor-cervically and mesiodistally compared to the deciduous mandibular central incisor. It has an obtuse disto-incisal angle. The root of the deciduous mandibular lateral incisor is conical and is longer than that of the deciduous mandibular central incisors. It shows a definite distal inclination at its apex. Moving on to the deciduous mandibular canine, it has several distinguishing features when compared to the maxillary canine. It is generally more slender in appearance due to its smaller mesiodistal diameter in relation to its crown height. The disto-incisal edge of the mandibular canine is longer than the mesio-incisal edge. The marginal ridges and the cingulum of the mandibular canine are not as pronounced as those of the maxillary canine. The labiolingual diameter of the mandibular canine is smaller than that of the maxillary canine. Coming to the mandibular posteriors. The deciduous mandibular first molar is one of the primary teeth in the lower jaw. The occlusal outline of the deciduous mandibular first molar is rhomboidal. The mesiolingual cusp is long and sharp. The most characteristic feature of the deciduous mandibular first molar is the heavy transverse ridge, which connects the mesiobuccal and mesiolingual cusps, running horizontally across the occlusal surface. The deciduous mandibular first molar is unique among primary teeth and does not resemble any specific permanent tooth. Its occlusal morphology is quite distinct from that of the permanent molars. Due to its specific morphology and the presence of the transverse ridge, a typical mesio-occlusal distal or MOD cavity preparation is contraindicated for this tooth. The deciduous mandibular second molar is the other posterior tooth. The general morphology and cusp arrangement of the deciduous mandibular second molar is similar to that of the permanent mandibular first molar. The cusp order according to size in distobuccal cusp more than, mesiobuccal cusp more than, distal cusp. Among the primary teeth, the deciduous mandibular second molar has the largest mesiodistal dimension. The pulp chamber inside the deciduous mandibular second molar contains 5 pulp horns. The deciduous mandibular second molar has an additional fifth cusp on the buccal surface known as the buccal cusp. It is considered to be one of the most susceptible teeth to dental caries in the primary dentition. The vulnerability is due to its complex anatomy, including the presence of fissures and grooves on the chewing surface that can trap food particles and bacteria. Now, coming to the maxillary arch, we will start with the maxillary deciduous central incisor. The mesiodistal dimension is greater than the incisor-cervical measurement. The incisal edge joins the mesial surface at an acute angle, and the distal surface at a more obtuse angle. The root of the maxillary deciduous central incisor is conical in shape, tapering gradually towards the apex or tip of the root. The next tooth is the maxillary lateral incisor. For this tooth, the disto-incisal angle is more rounded. Lingual anatomy is usually less prominent than its permanent counterpart. The root is essentially the same as that of the central incisor, except that it is longer in proportion to the crown. Moving on to the maxillary deciduous canine. All surfaces of the tooth are round and convex. The cervical area shows a more pronounced constriction or narrowing. The cusp is prominent and divides the incisal edge into a mesio-incisal edge and a disto-incisal edge. The mesio-incisal edge is longer than the disto-incisal edge. The lingual surface presents several features including a prominent lingual ridge, lingual fossae, and marginal ridges. Coming to the maxillary posteriors. First, we will discuss the maxillary deciduous first molars. The occlusal surface of the tooth has a triangular shape. Among the 3 main cusps on the occlusal surface, the mesiolingual cusp is the largest, followed by the mesiobuccal cusp, and then the distobuccal cusp. The molar tubercle of Zuckerkandl is a small elevation or tubercle found on the mesial aspect of the tooth near the occlusal surface. The tooth has a prominent ridge that runs along the cervical area on the buccal side. The maxillary deciduous first molar has 3 roots, one mesiobuccal root, one distobuccal root, and one lingual root. The lingual root is the longest and often divergent. the maxillary deciduous first molar bears some resemblance to the permanent premolars in terms of its size and occlusal anatomy. Among the primary molars, the maxillary deciduous first molar is the smallest. Lastly, we come to the deciduous maxillary second molar. Its largest cusp is the mesolingual cusp, whereas the distolingual cusp is the smallest. Its largest root is the lingual root, and the smallest one is the distobuccal root. It resembles permanent first molar and has the largest buccolingual dimension in the primary dentition. The cusp of Carabelli is observed in this tooth. There are some notable differences between the permanent and the deciduous dentition. You can pause the video here and take down some important points from this table. With this, we have come to the end of this video discussion. Hopefully, we have helped you revise this topic quickly. Now, you can head over to the MCQ section of our app for solving some questions. Happy learning!